Joined by Congressman Tom Price. This is as fired up as we've seen the President of the United States in quite a while. I mean...
he must be running for office.
Well, he's not, but his peeps are, right?
They are indeed.
Yeah, he wants to get people elected,
sure.
and he's concerned about the midterms. He made fun of the polls, made an allusion to the parable of the seed, that you can't plant something in the ground and expect a week later that you're going to see it grow. Made fun of reporters for using the polls. And he blasted you guys. He's blasting Republicans. He's saying, you guys want to repeal this thing? You go ahead. You want to tell kids that they can't get a Pell Grant, that they can't get a college loan? You go ahead. What do you say to the president?
Well, we've looked through this bill now, and I think we've come up with 10 pages that are actually decent. So 2,690 pages we think ought to be changed, repealed and replaced with positive, patient-centered health care. That's what we put forward, and that's what we'll continue to fight for, because that's what the American people want.
Okay, and the president just answered you, so I'll kind of use this as a refutation, using what the president was just talking about. The president just said, well, what you guys want to do is essentially also, let me find the words, you also want to find a way to control and regulate the insurance companies. Same thing as he's doing, right?
What we want to do is put patients in charge, not government or insurance companies. And this bill, the bill that the president signed, puts the government in charge. And that's not what the American people want. Now, there are positive reforms. There are things that we have put on the table that we believe make it so that patients and families and doctors can make medical decisions. As a physician, I know how important that is. It's imperative, and that's what the American people want. That's the direction we ought to be going, not this policy that has been put in place now that not only doesn't put patients and families and doctors in charge, it'll increase costs and decrease quality.
But do you still want to repeal this? I mean, do you still want to throw, because I'm hearing from your camp, I'm hearing repeal, replace, maybe not repeal, maybe repeal some, but replace others. What, give us a definition of what you're actually talking about.
Look, we want to repeal the stimulus bill, that money that hasn't been spent. We want to repeal the TARP money that hasn't been spent. We want to repeal the egregious aspects of the policies that this president and Speaker Pelosi have put in place. And that includes the portions of the health care bill that put the government in charge. We want to repeal the Democrat government takeover of health care, yes.
Let me ask you this question. If you start taking this bit by bit, don't you get yourself in a little bit of trouble? How do you say to somebody who finally has insurance for their kid who's 22 years old, who just graduated at college, because of this economy, they can't get a job. The parents can't afford to insure him. It's another $500, $600 for this kid. And if he has a pre-existing condition or something like that, like diabetes or something, that's really tough. How do you say to them, I'm sorry, I know President Obama gave you that, but I, Tom Price, Dr. Tom Price, I'm going to take that away from you. How do you do that?
The fact of the matter is we've got positive solutions that allow individuals to get health coverage. Every single American will have the financial wherewithal to get the coverage that they pick for themselves, not that the government picks for them.
But hold on, Congressman. What about that case? I mean, that's one significant, concrete example of what these guys are trying to do. And, you know, one of the biggest problems they're having is selling their message. But at least they got this one thing that you could say, okay, that's one concrete thing they can do. Would you keep that?
Kids up to age 26?
Yes.
It was in our bill.
Okay.
That's one of the things that we proposed. That's part of those 10 pages out of the 2,700 pages. The good news is that there are positive solutions. The bad news is that the President and Speaker Pelosi and her crowd put in place a bill that the American people don't want. It's going to decrease the quality of health care, and it's going to increase the cost. I talked to a doctor yesterday who said, I'm no longer going to be able to practice. I'm leaving the practice of medicine. The New England Journal of Medicine came out with a study just last week that said that 1/3 of the physicians of this land may, in fact, leave the practice of medicine. New England Journal of Medicine, no friend of conservatives, say that the doctors of this land are very, very concerned about what this bill includes. That's why we believe it's going to decrease quality, increase costs.
To be fair, you know that I have friends who are doctors who started leaving the profession when HMOs took over.
Sure.
So it's not just this bill. Doctors have kind of been some unhappy guys for quite a while.
Right.
I mean, I'm not speaking to you, obviously, but there's been a problem out there with the medical profession. And the insurance business has had as many problems dissatisfying doctors as this promises to have.
Yeah, you're absolutely right. And none of the workforce issues are addressed in this bill at all. And we are really, we're decreasing the pipeline of physicians coming into this nation right now in terms of education. But the fact of the matter is that there are positive solutions, and that's what we ought to be concentrating on. That's what wasn't concentrated on when this bill was passed.
Isn't the whole thing really about being able to create something that allows small business guys, a guy who's got 12 employees, and all of a sudden, I'll go back to the diabetes example, he's got 12 employees, they're all generally healthy, but all of a sudden the 12th one, and no one's allowed to know who he is, by the way, develops a debilitating disease, diabetes or something worse, right? Horrible heart attack. Well, the other 11 now have to have their premiums jacked up, and the employer has to charge more for it, has a hard time keeping his employees. That same employer can go to Canada and pay $4, $5, $6 less to hire those people. I mean, whether it's your plan or Obama's plan, there is a fundamental problem with health care system in the United States.
Rick, as we've talked about before, the status quo is unacceptable.
Okay.
The status quo is unacceptable. And we've been saying that for years. There are huge...
Now, why didn't you do something when you were in power?
Well, I was there only 3 terms, only 1 term in the majority. But the fact of the matter is Republicans worked with Democrats to increase the availability of HSAs and flexible savings accounts and things that were responsive to people. Also, regardless of what you think about the policy, the Medicare Part D program, the prescription program in Medicare, was the largest change to Medicare in over 40 years. So there were some things that were done. Now, what we didn't do, what they didn't do before I got there, was to ram a bill through that the American people didn't want. And they refused to go against the 60-vote margin in the Senate.
The polls still show it's down. By the way, since you just said that, the president said this is ridiculous. It's been a week. How can you criticize something that's only been out there a week? He's confident that with more speeches like the one he just gave in Portland, Maine, he's going to get the American people turned around by the midterms. And can he do it, and what are you going to make sure he doesn't?
I don't think he can, because the American people don't like what was passed. And it was the president.
What about the argument that if you look at it, if you parse it and look at its parts, the American people will like it? That's what the Dems say.
They like the headings. They like that you got to do something about pre-existing. Yes, but there's a way to do it that puts patients in charge and not the government in charge. You got to do something about portability. You ought not lose your insurance if you change your job or you lose your job. But there's a way to do it that puts patients in charge, not the government. And with all due respect to the president, it was the president that came out the day after the bill passed and said, no, the sky's not falling, right? The sky's not falling.
Right. And he said it again today.
But what we've seen is individuals who will lose jobs because of this piece of legislation.
I like your handshake.
Thank you.
That's a man's handshake right there.
It's a surgeon's.
Congressman, thank you for coming,
Thanks,
sir.
Rick.
You're very kind of being here just at the right time as the president was done with his speech and being able to give us a different perspective on this. That's very much appreciated.